Hi, my name is Dr. Roland Phillips, and I'm coming to you from Desert Dove Health Alliance. And what I'd like to talk to today about is homework. So in our office, this is a wellness practice, and we're not treating anything specific. If you understand holistic health, what we're about is to create the environment inside the body, inside the mind, the brain, the energy field, such that the individual heals on his own. To do that, we've got to become active participants in our healing. And so in our office, we talk about passive and active healing. In the allopathic model, there's very, very little change the person has to do, and therefore there's really very little healing that happens. But from our perspective, and what we do in our office, we get our clients actively involved in multiple aspects of their life. So let's talk about the two brains that we have. In BEST and in holistic healthcare, we talk about the two brains. The first brain is our conscious brain. This is where I think, discern, reason, understand time. It's linear, it's logical, it's analytical, it's language driven, and it's also always in the process of learning. So to the day we pass, we're always going to be learning more in this thing called the conscious brain. The conscious brain does not directly influence the physical body. But then we have the subconscious brain, or the autonomic nervous system, and the limbic system. And this part of the brain doesn't think, discern, reason, understand time. It's not analytical, but it's created to run the physical body and to run it according to survival based on present need. Now what can happen is that this system can get jammed due to the three T's we talk about: trauma, toxins, and thoughts can jam the system into fight or flight, and then that system, that brain, is going to run over and over, get stimulated by the senses, and something's going to get exhausted. So as we do the procedure called bioenergetic synchronization technique, we start to give people things at home to do so that they do not rejam the system and they allow themselves to keep moving forward in the healing direction. So we can get our conscious mind involved, and this is how you get involved. You start to pay attention to what's going on between your ears. So if you have negative thoughts or emotions or physiology, things that are repeating, if you continue to entertain those patterns, they're going to go deeper into the brain and have a quicker response on the body, and the body is going to get more exhausted. So what I can start to do is become aware of what's going on within and around my life, and I can start to make choices and changes. And as I make these changes, according to the law of neuroplasticity, that current science says that we have the ability, if we change our input into the brain will mold into a new pattern. And what we're doing is we're changing input into the subconscious brain, so we have a different physical response in the body, but even more importantly, we have a different response into the energy field, because according to the law of attraction, whatever's vibrating in my energy field, that's what I'm requesting from life. So I want to consciously and intentionally put my attention on joy, kindness, love, forgiveness, compassion, bliss, and then to act appropriately. That's going to change my behavior, my moods, it's going to change my physiology, and it's going to change what I attract in my life. And if something is a challenge in my life, I'm going to think, this is exactly what I needed in my life to get better and to perfect my ability to be peaceful, joyful, loving, kind, and gentle. So the power of our emotions is that if you've got powerful, positive emotions going on, love, joy, happiness, forgiveness, bliss, faithfulness, you're just feeling good inside, that's an indication that you've been making choices to create that physiology. But if you've got negative emotions like fear and judgment, or an inflated sense of self, or you're demanding, or there's anxiety, or there's apathy, or there's self-contempt, loathing, and shame, it means I've been entertaining something in my mind that's reinforcing this pattern. What I can also do is I can say, when I have these negative emotions, that's a direct challenge to my belief systems. Do I continue to believe what I've been believing, and then I'm going to get these emotions over and over again, or can I use when the negative emotions come up to question my beliefs? So what we do in the office is we start to get people involved in the forgiveness process, and we say there's 5 steps in the forgiveness process, and I have my clients journal on this. They will journal on the first step, which is to forgive other people for what they've done or not done to you. The second step is to give them permission to forgive you for what you've done or not done, or would like to do in retaliation. And then the third step is to forgive yourself for any harm you've done to yourself, commission or omission, to your body, your finances. and how you've harmed yourself as a result of holding on to what we've been holding on to, or neglecting what we need to embrace and to continue in our lives. The next step of forgiveness is to learn the lesson of the moment. And learning the lesson of the moment is as simple as this. In this moment, if I accept and say yes to this moment, in this moment, it will be obvious what I have charge of. And we call that stewardship. So in this moment, what do I have charge of in stewardship? And I allow myself to fully immerse myself joyfully, happily in the now moment. And what do I not have charge of? Other people's choices, other people's behaviors, opinions, what I've done in the past, what's going on in the air. I don't have any charge of that. And I don't have to if I'm in charge of my stewardship, and if I'm taking charge of my choices happily. I'm going to have a good physiology going on, and my body will heal on its own the way it was created. The last step of forgiveness is to be thankful for the lesson and to implement that lesson in the now moment. Now in this office, and if you're a best client or a best practitioner, and in our office what we do is we do a procedure called the motor march. And this is what I would challenge practitioners and people who are doing best when they're doing the motor march. Do the motor march until you feel a shift. Whether that's 1 repetition or 30 minutes of repetition on that motor march. You want to feel a shift in your physiology. Is there more ease with your system? Is there better range of motion? Are you breathing better? Are you feeling more energetic or happier? It's going to take 1 repetition or maybe up to 20 or 30 minutes if it's a very deep pattern. Continue doing the motor march until you feel a shift in the pattern. Then get about your day. And the last thing that I would share with you is homework that's very, very powerful, is rhythmic abdominal breathing or aerobic exercise. Aerobic exercise and rhythmic abdominal breathing is one of the ways we can buffer the acid that we're making through our habits or our choices or what's in the environment. This buffer system is 30 times greater than any buffer system that we have in our bodies. So we recommend a minimum of twice a day for 5 minutes doing some form of rhythmic abdominal breathing and hopefully aerobic exercise like walking. So these are the things that you can start to implement today if you will make changes happily, joyfully in your 6 essential choices. There's no reason why your body can't heal from within according to its own rhythm and rate as factors are favorable. This is Dr. Roland Phillips at Desert Dove Health Alliance. Have a best day.